guys, it's Sheena from Teton Raptor Center, and I'm here to give you all this week's patient update. So let's go ahead and get started. First up this week is Great Horned Owl 10-6, and this bird originally came in from Lander, Wyoming with a fracture in his coracoid on the right side. The fracture is healing up really nicely, and we are going to be moving this bird into the flight barn next week. Next up, we've got Merlin 10-1, and this bird originally came in due to a fractured right shoulder. The shoulder is fully healed, and this bird is flying around beautifully in his enclosure. We caught him up so that we could put a band on him, and he will be getting released actually this weekend on Sunday back in Driggs, Idaho, where this bird was initially found. Moving right along, we've got Red-tailed Hawk 923. This bird initially came in with a broken left femur. So we did do surgery on the femur and put an orthopedic pin as well as external fixators around that bone to keep it in place while it heals. And he actually was able to get his pin removed this week in a second surgery. So here's some footage of that second pin removal surgery. Of course, the bird is anesthetized so that he can't feel any pain during this process. So there is our veterinarian, Dr. Joe, removing the first pin, and then he's going to go in and remove the external fixators using a different tool, since those require a little bit more work to get them in and out. And because this pin removal surgery can sometimes be a little bit painful, we did put him on a course of anti-inflammatories to keep him nice and comfortable once he woke up for the next few days. However, he's finished his anti-inflammatory course. He is out in the PCU, and he's able to get up on his highest perches, and then we're actually going to be moving him into the flight barn over the weekend. So we're really excited to see that he's moving right along and progressing really nicely. Next up is Great Horned Owl 920. This bird initially came in with a broken wing on her right ulna. That bone has healed up beautifully without the need for surgery, and she's actually begun flight conditioning in the flight barn. Here is a clip of her being released into the flight barn, taking her very first flight since her wing has healed. And as you can see, it looks beautiful and symmetrical, so that's exactly what we were hoping to see for her very first flight out in the flight barn now that her wing has healed. Next up is our juvenile golden eagle. This is Golden Eagle 8-6, and this bird has actually just been transferred to a falconer, and this is so that the bird can get conditioned appropriately for release back out into the wild. So basically this process just involves sending the bird to a falconer where they can help condition it to hunt and to fly, because even in a flight barn there's just not enough room to do this. So here we are loading the bird up in a kennel to be moved to the falconer. Here we have Swainson's Hawk 8-5. This bird will have to be overwintered here with us at TRC just because he has missed his window for fall migration. However, we still think that this bird could be a candidate for release. He is undergoing physical therapy regularly and doing well so far. Last but not least this week, in covering all of our birds in rehab, is American Kestrel 8-1, and this young female bird is still here with us. I know that it's been a long time. However, we do think that she's dealing with a nerve injury, and sometimes these nerve injuries can take a really long time to heal. So she also will be with us over the winter, and we've got her on a medication called gabapentin, which many of you might be familiar with. So that's going to hopefully help with any of the nerve pain that she's dealing with. All right, that's all we've got for this week. Thank you guys so much for tuning in, and I look forward to talking with you all next week. Remember that if you want to do your part to help keep wild birds wild, you can check out our website at tetonraptorcenter.org and make a donation. Bye!